my name's Valerie. How can I help
Hi,
you?
I'm Claire.
Claire, wow.
My
Okay.
ankle's been hurting really
Okay,
bad.
well, sit down. Sit
Okay.
down. Let's see.
My
what's
right
going
side.
on. Okay. Okay. Down here? Yes. How long has it been going on?
Few days.
Really? Okay. Any trauma at all?
No, not that I know of.
Okay. Okay. It's a little swollen. Doesn't feel warm at all. So, okay. Well, let's see if your doctor can see you. Okay. I'll have someone come in and take your vitals. Okay.
Okay. Thank you.
Help you feel better.
Thank you.
Hi Claire, my name is Suki. How are you doing?
Hi, nice to meet you.
I'm going to take your blood pressure, okay?
Okay.
I'm sorry you're in pain. How long it's been going on?
For a few days.
A few days. Oh. So your blood pressure is a little low. Like 94 over 50. Is that how low it's been?
That's pretty low for me.
Oh, really? Okay. Let's check your temperature.
Okay.
It's 100.7. It's a little high. Did you take any Tylenol or Motrin for pain?
No.
How long it's been going on, you said?
For a few days.
Okay, so let's see what Dr. Doe says about, maybe he'll see you in the clinic today, okay?
Okay, that would be great. Thank you.
You're welcome.
Hi, Claire.
Hi,
The
Valerie.
visit go okay?
Yes.
Oh, good. Okay. So Dr. Dow just wants you to go downstairs and get some lab work.
Okay.
And then as far as if you're not feeling better in a couple of days, or if there's any problems, be sure to go to the emergency or urgent care first, okay?
Thank you.
Okay. Thank you very much. I hope you feel better, okay?
Thank you.
Claire, what's going on? What's going on? What's going on? Okay, lie down.
Oh, my goodness.
Please call code blue. Please call
Code blue, room 3. Code blue, room 3.
I've got a
What's
pulse.
going
It's
on?
weak.
What's going
Yeah, she's
on?
being called.
Dr. Dow. Sorry.
No, she just came and kind of passed out.
Okay, she had a scheduled appointment.
Her blood pressure is
Okay.
a little low. So I'm going to raise her feet up a little bit. Call code blue,
Okay, I've got
please.
the oxygen
It's
going.
weak and
I've got
Freddie.
the oxygen. Anything else? Okay.
She's a full code,
Oh,
Yes, she's
yes,
a full
she
call.
is.
74-year-old female.
Yes.
She was here 4 days ago for a hurt ankle, thought it was gout. Apparently it's not gout now.
Okay. So her husband says that, you know, she wasn't feeling good over the weekend and wouldn't go to the emergency room, so she thought she'd keep her appointment with you today.
And she had labs, her white count was quite elevated.
So
She
last
was
time.
called to come in.
Oh, no. Okay, I don't
And she
know about that.
refused.
Uh-oh.
So
Okay.
Dr. Dow, code blue team is here. Would you mind giving them a report so we can get them back on the
The
gurney for
ambulance is
her?
here.
So
Okay.
I think she's incontinent of feces and urine. So let's get going.
Okay,
on the
74-year-old female. Presented to the clinic. It's now pulseless. And blood pressures were low prior to that. She's a full code.
Mr. Smith, I know this is very difficult for you. I know this is very scary, but we're here to help your wife. I'd like you to come to the ER with me, and we'll go see her, and you can be by her and hold her hand. So please come with me, sir.
So, personal knowledge. This really happened in our clinic, and as far as, it's unfortunate that it's happened too often. So, I hope we learned something from this.
It's really important that after a situation like this that we debrief We need to come together to find out what went well, what didn't go well, and how we can provide further education. So team, can you tell me anything that you think went well during this code?
So I think we were lacking resources to start IB, and room size was a little smaller to fit the entire team. And the doctor did call the report to the core team so we could facilitate the transfer to ER, so for timely treatment. And here's the patient. Do you have anything to say?
One other thing before we talk about that is, tell me, is there anywhere that we can improve upon besides
yes.
having a bigger room, bigger
Yes.
than the
Yes.
stamp size room, of course?
Of
Yes,
course,
yes, no.
Best Practice Act alerts.
Yes, that would be great.
And protocols
A
for
protocol,
sepsis,
yes.
for outpatient.
That would help us all, right, doctor?
Protocol would be very
Yes,
helpful.
yes, no.
And then, of course, with that, education and training is the key.
We plan on having mock codes again,
Again,
so this will really help us learn.
And we'll be doing the ethical piece of doing the right thing for the right time, for the right situation.
Overall, thank you so much for saving my life, doctor and nurses.
You're welcome.
Sepsis is real. It affects millions of Americans, and it can be treated with early identification, adherence, and education. Thank you.
Thank you.
Thank you all.